Hi everyone, welcome back. In this part 2, we're going to be discussing disorders of the digestive system. You should have already watched part 1 or been a part of a lecture in class for part 1 where we discussed the anatomy and physiology. We're just going to be focusing on disorders during this section. We're going to be picking the 16 most common disorders of the digestive system, starting with colon cancer. Colon cancer is among one of the more prevalent cancers in the US. In fact, 1 out of 20 will get it in their lifetime. And the reason why we spend so much time preventing against colon cancer is because it's a cancer that when you have it, you don't experience symptoms until very, very late in the stages of colon cancer, until you're at stages 3 or 4. The stages of colon cancer will correspond with the size of the tumor in the colon, and also when the tumor invades local tissues like the cardiovascular system or the lymphatic system. Again, the earlier you catch colon cancer and that tumor is able to be removed before it starts to infiltrate surrounding tissues, the better the prognosis or the survival rate that you have for that. So a lot of emphasis is placed on prevention. This is a picture of myself and a couple of my best friends. My best friend Elise lost her mother to colon cancer in less than a week between when they found out that she had it and when she passed away. So it's a cause that I'm definitely very personally affected and want to make sure that people know about it. The easiest way to prevent against colon cancer is through screening. Until a couple of years ago, the most common way to screen for colon cancer was a colonoscopy, where they put a flexible, thin camera through the digestive system, through the anus and up and around the colon. It's done while the patient is awake. They give them a mild sedative just to make them more comfortable. If you're curious about what that looks like, Carrie Kirk several years back actually interviewed during her colonoscopy to kind of raise awareness on how helpful colonoscopies are at saving lives and make them a little bit less scary and more approachable for people. Thankfully, there's another better option, at least easier option. There's new products now. One example is called Cologuard, where you actually ingest this product and then it'll screen whether or not you have DNA from cancerous cells. They'll collect a fecal sample and then they'll run DNA analysis to see whether or not you have any cancerous or precancerous cells. And then they will follow up with a colonoscopy to see whether or not they can visually diagnose any tumors. So good thing is that with screening products like Cologuard in combination with colonoscopy, colon cancer is definitely one of the more treatable and screenable cancers. Moving on to number 2 is GERD. GERD stands for gastroesophageal reflux disease. While this is the same thing as acid reflux, this is not the same thing as just normal heartburn. So it's pretty typical that if you have a meal that is really acidic, or if you have a poor diet, or if you eat and then go directly to bed and you're laying down, that you might experience a little bit of heartburn. It feels like burning kind of in the center of your chest, like where your heart would be, which is why it's heartburn, although it actually happens in your esophagus. And it's caused by acid in your stomach seeping back through that cardiac sphincter in your digestive tract. Again, heartburn is a little bit less severe. Acid reflux is when you actually have damage or the muscle sphincter between your esophagus and your stomach isn't working properly. And that means that you're continually introducing the lining of your esophagus to that that low pH environment. And repeated exposure to that can actually increase your rate of esophageal cancer. So there are plenty of prescription and over-the-counter medicines to help combat that in combination with like increasing your awareness on what you eat and making good choices in your diet. The third condition we'll talk about is dysentery, which is a condition just where you have rapid diarrhea where you can't absorb water. Remember, a large intestine anatomically is mostly in charge of reabsorbing water and then a few nutrients. But with dysentery, this is when you have loose and watery stool to the point where you aren't getting enough of that hydration that you need. It can be caused either by parasites, it can be caused by bacterial or viruses. And one of the more common examples of a condition that causes dysentery or diarrhea is cholera. So cholera is a specific type of bacteria, and it causes massive loss of water. And this bacteria, unfortunately, is transmitted through water. So when you're looking at areas of the world that have unclean water sources where people drink out of streams or rivers, those same streams or rivers that are gathering unsanitary water that would probably have some of that fecal matter in it, it's a kind of perpetuating cycle. The sad thing about cholera is that it's 100% treatable, and it is really easy to overcome as long as there's infrastructure that will give patients who have cholera proper hydration. The way you beat cholera is by giving them an IV of fluid and sugar. And this can be done in even the most primitive setups. But for countries that don't have this kind of infrastructure, or this type of medical diagnosis, that's when cholera becomes a huge, huge problem. So it's really, really sad that this is such an issue in the world, but it is. So it's definitely something that we can increase our awareness of and do a little bit better at as a planet. Number 5 would be IBS, or irritable bowel syndrome. So this is actually a syndrome that affects a lot of people in the United States, yet it's a syndrome that we actually don't know the cause of. It's characterized just by the muscles of the bowel contracting kind of spastically where you can't control it. And being very unpredictable. So it causes people to kind of have gas or pain and be very, very uncomfortable, and it's very random and you're not able to predict when it's going to happen. However, that's not as severe as inflammatory bowel disease, or IBD. So Crohn's and ulcerative colitis are 2 examples of IBD, not exactly the same as IBS. Because IBD has more to do with the immune system. So with Crohn's disease, that's when for some reason your body is actually attacking the inner lining of your digestive tract. And because of that, it becomes inflamed, it can be very uncomfortable, and people who have Crohn's disease may actually have a portion of their large intestine removed if it becomes too inflamed or too problematic. Stomach ulcers is our number 7. That's not actually caused by stress at all. So there's a big misconception that if you have a really hard job, or if you're very stressed out, it'll cause ulcers, when in reality, ulcers are caused by a specific type of bacteria called pylori. And this bacteria will actually infest the they will invade the inner lining of the stomach, that mucosal layer. So it can be treated with antibiotics. And while stress doesn't cause it, stress can definitely exacerbate this symptoms and can help with the infection. The 8th disease we'll talk about are hemorrhoids. And these are when you have veins around that sphincter, the anus, that due to either straining or childbirth will actually swell and become really itchy and uncomfortable, and they can actually burst and cause bleeding during bowel movements. So hemorrhoids are usually treated with like topical creams, but also just through rest and making sure that you're taking care of your diet to make sure that your bowel movements aren't as strenuous. Number 9 is lactose intolerance. So this is one that you may have learned about before when you're in your biology class learning about enzymes. Because lactose intolerance is a genetic condition where you have a faulty gene that produces the enzyme or the protein lactase. Lactase is an enzyme that breaks down and catabolizes lactose, which is the main sugar that's found in dairy. Lactose is lactose is made up of glucose and galactose. Those 2 monosaccharides are bound together, and when our body can't break that bond, it will choose to get rid of that lactose sugar in the quickest way possible, which is usually pretty uncomfortable and usually results in diarrhea. Number 10 is celiac disease. So celiac disease is an immune response where your body believes that the gluten found in a lot of grain products is damaging the body. So that launches an immune response, and it actually will respond by attacking the villi of the intestine. And without the villi, if they're attacked, if they're damaged, that person has a lot of trouble absorbing nutrients. So the best way to handle this is just through the person changing their diet and making sure that they don't expose their body to gluten. Number 11 would be appendicitis. So if we break down the word, that's the swelling or the inflammation of the appendix. It was believed for a while that the appendix didn't have an actual cause. However, we do know that the appendix is able to store bacteria. And we're learning more and more about the microbiome that lives inside of our intestines and inside of our colon. And we believe that there is some purpose there. We'll be reading an article about this in class. Number 11 is a hernia. So a hernia is usually caused through extreme strain, and it's whenever a bend of the intestine will actually poke through the abdominal muscles. The layer of fascia that typically holds the abdominal muscles down, when that layer has a gap in it and you strain, the combination of that pressure can actually make some of the intestines protrude outside of the normal abdominal cavity, and it can be extremely, extremely painful and also pretty detrimental. It has to be fixed. You can actually manually massage the intestine back in if it's not severe. Otherwise, it has to be surgically reintroduced. Number 13 is gallstones, and gallstones are found inside of our gallbladder when there's a imbalance inside of the gallbladder that comes from too much cholesterol in the diet. Gallstones start out being very, very small, and as the cholesterol builds and builds and builds and builds, they can get as large as a golf ball. Gallstones can be broken up, they can be passed naturally, but if they start to block the duct completely, they would have to be surgically removed. 14 is malnutrition, and there are two examples of this. We'll read about the lack of vitamin C in an article in class. We kind of talked about it already, causing scurvy. Another malnutrition or example of malnutrition is rickets, and that's when somebody has too little vitamin D. And if you remember from your biology class, vitamin D is something that we can only produce when we eat certain things in our diet and then are exposed to sunlight. So the sun helps us break down vitamin D, and I shouldn't say break down, helps us process precursors to vitamin D and create them into vitamin D. So individuals that are not exposed to the sun, especially when they're young, don't have enough vitamin D in their diet and therefore can have problem with development. A lot of times rickets will affect the bone density in legs. So you can see these examples of the children that have rickets and they have that bow-leggedness. Children now under the age of 1 have to take supplemental vitamin D. Since a lot of babies aren't supposed to be exposed to the sun because their skin is so sensitive, they take vitamin D in the form of a supplement until they're about 1 year old. Number 15 is obesity. So you guys are all probably familiar with the idea of a BMI. And while it's not really a great predictor of overall health, it can be a good indicator of whether or not your weight is appropriate for your height. Again, not a perfect system because it is a very easy to calculate index, but that does mean that there's a wide margin of error. Because of the obesity problem that we have in the United States, there are 2 treatments for extreme obesity. The first is gastric bypass. So we know that our stomachs and our entire gastrointestinal tract are designed that nutrients will be exposed to the epithelial cells inside of our intestines. With gastric bypass, essentially what you're trying to do is eliminate the time and eliminate the amount of nutrients that are being exposed to our intestines. So we essentially would completely bypass the stomach portion of our intestine, thus reducing the amount of digestion and absorption that occurs, thus reducing the amount of calories that would end up in our bloodstream. The second example of that, which is a little bit less invasive, is called a lap band. And the lap band can actually be temporarily applied and then removed. The lap band is when you take the upper part of the cardiac portion of the heart and you restrict it. And this would make it so that as the person is eating, they're satiated quicker, meaning they feel fuller quicker, and their body's not able to digest as large of a meal. So they eat less and therefore consume less calories overall. The last condition we'll talk about is called dysphagia. And this is a condition where people have trouble swallowing their food. If you watch this quick video, there's a bunch of different types of dysphagia, but essentially it's when either your nervous system doesn't allow you to swallow food, it feels like you're choking. It can cause vomiting or like gagging reflex, and it can also cause aspiration when you swallow, instead of it going into your esophagus, it goes into your trachea, which can result in aspiration pneumonia, where that food particle actually ends up in your lungs and in your alveoli and ends up getting infected there. And that's what aspiration pneumonia is. So these were the 16 disorders of our nervous system, and I hope that was helpful.